with all of his experience and things like that. He's just brought so much to the wound care center, and with him being surgeon, and the patients just adore him.
I was Dr. Steele's office nurse for 23 years, and he went to wound care, and I went with him to wound care, and we worked. It ended up being 26 years. Working with Dr. Steele is a trip. It was a lot of fun. I learned so much from him, and he was always very conscientious about the patients, and never, ever asked, did they owe money, did they pay their bill. Didn't care.
Well, Dr. Steele was here when I came to Valdez Hospital in 1991, and he was one of the core group of physicians that recruited me to be here these past 27 years that I've been here. And I have a lot of good memories of working with him in the cancer program. He was always at tumor boards with us, and just an excellent physician and always full of good stories. Even today, we stopped and talked, and he could have gone on probably for another 30 or 40 minutes just talking to me and telling good stories, but the line was backing up. So it's been a great pleasure to know him, and he's been a blessing to a lot of people over the years.
I would ask Dr. Steele to help me in surgery when I was doing a gynecologic case, not only because he was very good at what he did, but we would wind up getting a lecture on any of a number of things like history, philosophy, the Shroud of Turin, religion, all things UNC Chapel Hill. And so it was fun to be with him. He was a great colleague. I really enjoyed working with him over the years, and I wish him well in retirement.
We're sad and humbled that Dr. Steele has decided to retire, although it's good for him to be retiring and moving on to do other great things. I'm Dr. Mazzola. I have the privilege of being the Chief Medical Officer here. I did try to find some things about Dr. Steele. I asked for some stories about Dr. Steele. He and I were just talking about, his foray into medical honey. As we all know, that he has saved many limbs and treated many wounds that probably wouldn't have been treated the way he treated them. So Dr. Steele has embarked on another 15 or 16 years of treating patients. I did get a story, I don't know if it's true, but I understand he also is a ingenious snake charmer. Apparently at one point Valdez Hospital was the home of a snake on a nursing unit, and several. And I hear that Dr. Steele had a propensity for using a mirror and a noose and maybe some anesthetic, and had the patience of a surgeon, and waited for the snake to come out and lassoed him, and at least took one of them out of the hospital and released it.
I took 4 of them up to the mountain up there and released them
At different times, so I'm sure the nurses appreciate it. So considering that, we did, wanted to have a little momentum. A pillowcase, yeah, we'll get a pillowcase. But really, it's I'm humbled to have gotten to know you, and I know you've taught some of our residents over the years that we've had the residency program for the past 7 or so years, and I know there's hundreds and hundreds of patients that are indebted to the service you provide to this community. I also understand one of the first 2. I heard a story that you lasered your arm so that you could prove that laser treatment
can take
the spots off.
Take those brown spots off.
Yeah, and so you lasered one so you could do the comparison and show the patients.
I thought they would stay gone probably 6 months. It's been about 25 years.
So again, an innovator and has brought to this community treatments and therapies that are world class. And I know Mr. Mercer wants to make a few comments probably.
Yeah, so I'm John Mercer. I'm the Chief Operating Officer here at Carolina's Healthcare System Blue Ridge. And again, just wanted to offer my congratulations to Dr. Steele. David Pope couldn't be with us today, but wanted to be sure that I let you know how much he's appreciated all your services also. I've been with this organization almost 20 years now, and I started here in this building back in cardiac rehab back in 1998. And from the moment I started here, Dr. Steele was talked about by almost all of my patients that I work with in cardiac rehab. he is part of this institution, and I've really enjoyed learning and understanding the history of Valdez General Hospital over the years, and many stories that are involved there over your last 44 years have involved you, Dr. Steele. So you have touched so many different families and lives, and really changed lives for so many folks here. My favorite Dr. Steele story is one that you actually provided some of the, I guess you could call it entertainment, at our medical staff and board Christmas party one year.
Yeah, 2 years.
Yes, and I was absolutely amazed at the skills that Dr. Steele has. I mean, he would have a book, and he would hand someone a book, and he would say, okay, turn to whatever page you want to. And then they would turn to whatever page, and then he would tell Dr. Steele what page it was, and he would describe everything that was on there and even quote pieces from that page. This man has a remarkable mind, and always has, and it has really benefited the patients and the community here. Continues to have. So we appreciate all that you've done, Dr. Steele, and you obviously will be missed, but you definitely will never ever be forgotten from the folks who live in this community.
Thank you. I've been very lucky in my profession. I don't know how many people know, the first time I applied to medical school, I didn't get in. So I went to the Navy, and I was a hospital corpsman, and then I came back from the Navy, and I got in. And I worked as an operating room technician in the Navy. One thing, worked with the third heart-lung machine ever built.
Wow.
You could not order a heart-lung machine. You built one. Picked up a lot of things. I was in the Navy for 4 years, hospital corpsman, and that helped a lot. You know, you didn't necessarily think that was a big advance, but for me it was. It really was. And then went to medical school, and I got into surgery residency. Like I say, I've been very lucky, and I know doctors do other useful things, but I can't imagine anybody wanting to do anything more than surgery. You can actually fix things. It's like a mechanic. You know, they don't just try to do voodoo, they actually fix it.
Thanks, Dr. Steele.
Who John was, I was talking to him, and he was saying, you know, they don't open abdomens anymore. And I was, again, lucky to come along at a time when they started doing laparoscopy. And I've done laparoscopy for a couple of years, but they started doing, somebody talked about taking a gallbladder out that way. And I thought that's about the silliest notion I'd ever heard of. I could do tubal ligations and an occasional liver biopsy with a needle, and I could see where the needle was. Other than that, that's it. I mean, you got a finger and a light, and that's all you can do. And so I was curious enough that I went and took a course how you did laparoscopic gallbladders. And I'm very happy that I did. I like gadgets, and that's a great gadget. And actually, after a few gallbladders, turned out they're actually easier laparoscopically than they were open. And like I say, the people I've worked with, I really enjoyed that. It's just a wealth of them. Came to a great place. Not a big city where everybody's lost. Came to a great place, had great people here, and I just thoroughly enjoyed that. Always will, because I remember some of it. I don't remember as much of it as I used to. And the book doesn't work like it used to. But anyway, it's been great. I'm going to miss all of you. And I'll be around, but...
At JD's, right?
Yeah, probably at JD.
That's where I run into Dr. Steele.
Yes.
Well,
Thank you.
Steele, there's no way that John, myself, Miss Bailey, any of us could repay everything you've done for this community, for this hospital. Just a small token of our appreciation from the medical staff office for you, for your service, and to remember us by. And again, thank you for being an innovator, an inventor, a thinker. You've touched so many lives, and thank you so much, Dr. Steele.
Thank you.
One more present here for you. We've been blessed that not only have you been an excellent physician here, but over the last few years you've been an excellent teammate for us also. So this is from the Human Resources Department, and again, we just want to thank you for all that you've done for us.
Thank you. Appreciate it.